Dr. Bowers, thank you very much for joining us on the podcast.
I'm happy to be here.
It's been a long time coming. I've been trying to track you down for a while.
Yeah, and I've been fanboying you from a distance.
I appreciate that.
Not too far of a distance, but been a huge fan. And the open house was such a mesmerizing experience, and walked through this very room during the open house, so to be able to come podcast with you.
Yeah.
A few months later is a privilege.
Awesome. Well, thank you.
Yeah.
So you're a physician, you're an entrepreneur, you're a business owner, you're a dad, you're a husband, you're very involved in the community.
Yeah.
Give us just a quick overview of all the different things that you're involved with in addition to Dawson Medical.
Yeah, so Dawson Med is where I hang out, but I've been fortunate enough outside of that. You mentioned, I guess, first and foremost, dad, husband, son, spending some time with my parents now that they moved to North Carolina. Have the good fortune of being adjunct faculty at UNC Wilmington, and so spending time with students there, vice chair of the advisory committee for College of Health and Human Services. I'm a commissioner for the Wilmington Housing Authority, as I mentioned, just came from a meeting just a few minutes ago. Well, I chair the Regional Health Talent Alliance, which was convened by the Greater Wilmington Chamber of Commerce and CHEC.
Yep. And
so the Health Talent Alliance is a group of regional employers working closely together to work on talent and pipeline issues and other things like that. So a few things that just allow me to engage with the community. And you know, I coach little 6-year-olds basketball team, which is really, really fun. That's probably most fun. I enjoy the pipeline work. I'm one of the board members for the Chamber of Commerce, but clearly coaching 6-year-olds basketball is my favorite thing to do during the week.
Yeah, and I could imagine tests some different skills that
it does.
Maybe you don't get to test during the work day.
Patience and reiteration, because one 6-year-old, obviously my son is 6, but 8 6-year-olds right at a time, it's a different level of pew, 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 trying to grab these little guys, but it's fun. I look forward to practice. The games are really fun, but practice is when we really kind of just try to get a little bit better.
Yep.
So we've got a really good group, and we're undefeated. We haven't lost a game yet.
Very good.
As a coach, I'm like 3-0.
Nice.
So yeah.
Keep that rolling.
There we go. My kids aren't in the transfer portal yet, so I'm doing something right.
Yeah.
I must be doing something right. Well, so we'll see. I'll let you know if that changes. I might need some NIL money from you. I might need you to stroke some checks. You might need to help me out.
Oh, man, we could have a whole conversation about that.
We should. We should.
So when did you realize you wanted to become a physician? When did you realize you wanted to get into the medical field?
Probably in 3rd grade.
Okay.
And this story, it has a, I guess, happier ending, but a kind of a sad beginning. And my grandmother died at a really young age of complications from sarcoidosis. Okay. And as an 8-year-old, I had no idea what sarcoidosis was, but I knew that I didn't want other 8-year-olds that felt like the way I felt at the time. And so I said, I'm going to go be a doctor and either figure it out, fix it, whatever I said. But that was my motivation of having someone that was, you know, in her 40s, frankly, and died at a really young age. So that wasn't fun at all. Yeah.
And was anybody else in your family in medicine or practicing?
No, I come from a family of, it's a lot of diverse backgrounds, a lot of law enforcement, firefighters in the family. My dad is in, he was software IT, then he went to higher education and retired as an assistant dean in Virginia. But no, I'm the first physician. My sister is a nurse practitioner, and so my wife's an NP. But as far as physicians, nope. A distant cousin that I can't name him, I think that doesn't count. Right? I got a cousin who's a doctor in Tennessee somewhere, but I couldn't tell you his name, but I think he's doing pretty well for himself.
Yeah, so tell us a little bit about the track, you know, from 3rd grade, you know, knowing what you want to do when you get older. Not many people, I think, have that calling. It was
that spark, right, that motivation, and it just stuck with me as you come through the ranks. And if you're good in math and science, oftentimes the teachers or guidance counselors will say you should go into medicine or you should go into science. And I just kind of pulled that thread and followed it. And so through undergrad, biology, pre-med major, and again, those were the things that came naturally to me. Personally, my favorite subject is history.
Okay.
Absolutely love history. It's not even close. I just happen to, make a living by being a physician, but history is my passion. And then so through college, that was the thing. I did a couple of entrepreneurial things before med school. So that's kind of where that itch, right?
Tell us a little bit about what type of ventures did you get yourself into?
The very first thing was starting a home security company.
No way, really?
I did, believe it or not. So I was door to door selling ADT.
Okay.
And then I was like, I could make a business out of this. And so I'm hustling, right?
Yeah.
I'm just knocking on doors, fresh out of college. And then I realized, well, there's a lot of opportunity. And so we just expanded and we scaled. And here I was, 22, 23 years old, interviewing people in their 30s and 40s. And they get to the interview and they were like, wait, what?
What's going on here?
How is this possible? So I've gone through this for a lot of my years.
Yeah.
And then, just a few other entrepreneurial things. And I just realized that there's just this magic that happens if you're an innovator at heart. I've worked in a large system, and frankly, I didn't hate it, but it's not how I'm wired, right? So innovation and entrepreneurship is like oxygen to me. And without the ability to innovate, I slowly die.
And how did you find your way to Wilmington?
Sure. So my wife is a Wilmington area or Cape Fear native.
Okay.
So she was born at the hospital, formerly known as New Hanover Regional, grew up in Rocky Point. And so her family goes back at least 200 years to Rocky Point from her great-great-granddad. So she's got a really strong family roots and ties to this area. That was part of it, to be honest with you. We were in Charlotte. Worked for a large healthcare system straight out of training. I guess my first foray into North Carolina was in 2010 when I did my internal medicine training at Wake Forest. Okay. And so that was the first time I moved to North Carolina. It was a bit of a homecoming, believe it or not. I was raised in the D.C. area, but my dad's mom and dad both have roots in North Carolina. Gates County on his dad's side and Warren County on his mom's side. So it's a bit of a homecoming for me, even though I've never lived in either of those towns, right? But I do feel good, like North Carolina is my roots, right? I'm supposed to be here. So we, did the Charlotte thing for a while, loved it. But once we decided to hang our own shingle, we realized that A, the barriers are just a little bit lower in Wilmington relative to the large systems in Charlotte. Right. And B, the appetite from the consumer, from our patient, right, is greater in the Wilmington area for independent primary care. There's a lot of my friends have independent concerns in and around Charlotte, but we've just felt like the culture in the greater Wilmington area or the Cape Fear region for independent providers was a little bit greater. Yeah. Kind of the Port City Java following, right? There's just folks that just love that. And so we've just kind of been able to tap into that.
Absolutely. And so how long have you guys owned Dawson Med and operated that?
So 4.5 years.
Okay.
So we opened in 2021. And as you may have known, there's a clinic there. We talked about this before. I'm slowly getting over that visceral response when I mentioned opening in 2021.
Yeah, exactly. It's like there was something going on
Correct.
in the world.
Yeah, a bunch of therapists helped me get through that. So we survived opening a business during a global pandemic. I don't recommend it.
And not to mention a medical
facility, right? The die was cast, so we already had to kind of do what we needed to do. So we came from Charlotte. There was a clinic there prior to us, and I think they closed at some point in early 21, and we opened in the summer of 21. And so later this summer, we'll turn 5, and we've had such a beautiful run. I'm so thankful and so blessed.
That's amazing. Yeah, I mean, being a physician, you've got one role of seeing patients and running a practice, but then being a business owner, that's a whole nother set of responsibilities. How are you able to juggle both of those?
A lot of books.
A lot of books,
and a really good team.
Yeah.
And also being okay with acknowledging where you have not done well. And one of the things that I realized early on is that if you really build your team, esoterically, right, and physically, building your team, it really does make a difference because you as the physician are such an amazing part of the leadership and setting the culture, but truthfully, I don't have every interaction with the patient. I don't answer the phone. I don't check them in. I don't greet them. I don't do the vitals and the triaging. There's someone else doing that. And so being able to help them be at their best selves allows them to convey that to the patients. And so that's been our ethos, is trying to just build up the team, and then the team will take care of the folks.
Yep, I've read that philosophy in quite a few books, and when we've talked, I know we've read some of the same books
Yeah.
on leadership
Yeah.
and stuff like that.
Yeah.
And it sounds like it's such a fluffy, hard thing to really grasp. It's not very tangible, but putting good people around you is just a key to.
It is, in the books, to your point, that is really, it's the magic, it's the pixie dust. You can't even explain it, but personally when I read, I know I'm a better leader because I'm less likely to send that Teams message or that email, and I'm more likely to say, let's chat for a few minutes tomorrow.
Yeah,
right. And it's
exactly.
a very different conversation than what I'm feeling in that moment, right? And so I'm thankful for the books that allow me to really just kind of step back a little bit and just be a better leader. Long way to go, by the way.
Yeah,
my team will tell you, long way to go.
Well, 1% better every day.
There we go. Touche. Touche. Yeah.
How was working in a large, in a large medical system? How did that equip you for what you do now in more of a smaller, privately?
Yeah, and I appreciate that. We were part of it at that time, a 65,000 member organization. They are way bigger now. It's massive.
Yeah.
I guess this was 2013-ish for first few years, and this was before several subsequent mergers and acquisitions, mostly acquisitions. But it just let you know how systems work.
Right.
And so I'm really thankful for that experience because systems and organizational structure is so important. And so what we do is we've tried to duplicate that on a much smaller scale, but just having that structure, having some firewalls in place and having just some organizational discipline, it allowed me to see things at scale.
Right.
And then now you can duplicate that at a much smaller level, and then you can scale to that to the extent you have an interest. I don't.
Right.
But it's not my jam, but it just allowed me to see how things work. And some people work amazingly well in that system and that structure. Some other folks, it's just harder because you're so far away from the ultimate decision making. Yeah.
Do you enjoy having, how much flexibility do you have as an independent care facility versus a larger scale, and what are the risks maybe involved with having some flexibility, let's say, in the way you guys deliver your care?
Sure. Well, I certainly think there's flexibility because at scale, a lot of times the folks making the major decisions are not at the bedside. And so they may not even be in the city that you live in. They may not even be in your time zone, right? And so there sometimes are some misses with the best of intentions, right? Because I know folks that work for large systems in the Raleigh-Durham area, and so it's X amount of patients per minute, and they're literally tracking this, and they're tracking those metrics, and they're tracking how many are you seeing, and okay, you didn't, what's the problem, what happened, and there's this kind of feedback and accountability from a volume standpoint that I don't love. Don't get me wrong. We have to see patients, and we have to have enough volume in the building in order to pay the 401ks and the health insurance that everyone wants and competitive salaries. But just the discretion of, all right, if someone needs more time, then we'll give them that more time and we'll figure it out on the back end, right? And so, there are obviously financial concerns that we work through. Right. We don't have a bunch of other service lines subsidizing what we do. Right. In a lot of these large healthcare systems, primary care is a lost leader, right? Primary care often is just, not just, and I'm being really careful here, but there's a known, numbers game that primary care in a lot of large systems is a lost leader, and it's kind of referring to subspecialty and some acute care that changes the financial dynamics. Right. We don't have that, right? We're what we do, right, on a day-to-day basis, Monday through Saturday, is how we are going to pay the bills. And there's not a bunch of other service lines that are happening adjacent to us, putting another hose in the pool, right? We've got, primary care and urgent care. But, so it's a little bit different there, but nevertheless, our goal is to try to improve the patient experience. And so balancing all of that is the tightrope that I walk.
Do you think that people these days are becoming more interested in having more of a relationship with their care provider? What's your experience been like treating patients when you were part of a big system and now part of a smaller
I think individuals have different preferences regardless of where they are and the type of system that they get their care delivered. So a smaller concern, a smaller outfit that has 5 or 6 providers like us, or a very large multi-state entity that has hundreds and hundreds, you'll have patients that have different interests. Some folks are so busy and they're relatively healthy and it's transactional. Right? It's just like, I don't really care. Like, I just need this form signed for work so I can get a decrease on my health insurance, the biometric forms. And like, I'm fine, doc. All right, listen to my heart if you have to. And so that patient exists across all different types of systems. And then you have the patient that really wants to spend time with you. In fact, that may be the most important thing they do all month, right? Because they may not have a strong social network. They may live alone. They may be lonely. They may, frankly, be depressed. And that same person can be at an independent office like ours, or they can be at a larger, integrated system. And it's up to the physician or whomever is seeing them to identify, does this patient need more? And I feel comfortable in saying that does happen at large systems as well. There's some really good docs that work for large systems. I know that. I know that to be true.
And I wonder, if you've got health insurance with Blue Cross, for example, how much does that designate which providers you're going to see, because this one's in network or this one's not in network? And
being in network with Blue Cross, being that they're the largest player in the state, is pretty important. And then so being and so there's this weird thing that happens from a quality standpoint. And so if you're doing well, taking care of your patients, trying to prevent unnecessary hospitalizations, keeping blood pressure controlled, keeping diabetes controlled, ordering mammograms, colonoscopies, caring about quality, then the insurance companies will actually start sending patients to you because you've demonstrated, that you care about quality, because quality keeps costs down. So in the world that I live in, and I guess didn't mention this in the intro, I'm an ambassador for a large national accountable care organization. And so the goal of Aledade is to help decrease the total cost of care by supporting independent primary care clinicians.
How cool.
And so it's really an amazing thing because it improves patient experiences and outcomes, prevents things that are often preventable, increases revenue, in practices like ours, and decreases cost of care to the payers, commercial insurance, CMS, vis-a-vis Medicare. So there's a lot of good that happens in that space. And so insurance companies understand the value of care teams that want to decrease costs.
Very good. I'm glad to hear that. And in that vein, how does your practice, and let's be very specific, here in Wilmington, how, the ecosystem that we have here with Novant being the major player, Wilmington Health being another large one. Tell us about the ecosystem and how you fit into that with some of the larger players.
And so we're load bearing, We're a small concern. We fortunately have had some growth over the past year or so. Not all of it has been fun. Last June, there was an unfortunate passing of a physician, Richard Gutson, who practiced in Midtown. And so a good number of his patients have been absorbed in our panel. And we are also going to be expanding to Leland this spring. And so good friend and physician, Dr. Sanjay Badish, has decided to go do other things. And so we're going to be acquiring his practice and joining our folks with his folks, so we'll be delivering care across the bridge.
Awesome.
But to the larger question is, we're just trying to play a complementary role. We are very thankful for the presence that Novant has, very thankful for the presence that Wilmington Health has. They've got a ton of things that we leverage. We don't have subspecialty care, and so we often are sending patients to them on a daily basis for subspecialty care, oftentimes to the emergency department. And on the inpatient side, the Wilmington Health internal medicine team or hospitalists are taking care of our patients. So it's, as far as I'm concerned, a very complementary role. No one has the ability to see everyone, and that can be a large system in Charlotte, a large system in Raleigh-Durham. There's always going to be an opportunity for a comprehensive approach, large systems, medium-sized groups, smaller independent groups, to do the best to work together. So I see it only as just we can help amplify the ability to improve outcomes. Getting access to care is important to me.
Absolutely.
I don't care who orders your mammogram, Your wife's, your mom's. I just care that a mammogram was ordered. And I'm the son of a breast cancer survivor, and My mom had a very aggressive form of breast cancer, and she's with us today because we caught it early.
Wow.
Right? She happened to be a patient at Kaiser Permanente at the time, but who cares? Right? Someone thought well enough to make sure she had her annual mammogram, found something, unfortunately was cancer. We dealt with it, but that's kind of my North Star is get the things that we need to get done. I'm indifferent as to who does it. I just want patients to do well.
Yep. Yeah. And I'm hearing a lot about, collaboration and working together.
Yeah.
And you've been very involved with the healthcare talent pipeline that the Chamber's sponsored, and I know Novant and Wilmington Health have been, very much a part of that.
Yeah.
Tell us just a little bit about, the purpose of what you guys are doing in that initiative.
Yeah, and so I guess this is, again, around related to the COVID era. Yep. 2021, 2022, we had just gotten to town, my wife and I. But the area saw this rapid growth, right, in the COVID era with working from home. And a lot of folks had the same epiphany as, well, why can't I just do whatever I'm doing from the beach, right? So there was this amazing inward migration, right, that no one saw coming. Yep. At the same time, the hospital went through a transition right around that time, which is really difficult outside of a pandemic, but you go through a major once-in-a-generation transition during a pandemic. That's a heavy lift, right? Yep. And then travel assignments for nurses became a real thing. So nurses were able to leave our area and go make way more money, right, elsewhere on travel assignments. So there was just a lot of things happening at once. And what we realized, because the Health Talent Alliance, as you mentioned, from the Chamber to CHEC and even partners and stakeholders at UNC Wilmington and Cape Fear Community College and others, just realized what we're doing is not working. Right, and so we can continue this kind of arms race for talent, and your organization offers this nurse $2 more, $3 more, and for 2 days you've got her, then someone else offers her another $3 more, and so everyone's paying more, but no one's getting better. Right, the quality and the retention rate stunk, and so there was this brain trust that said, let's pull people together at the table and figure out how to solve this problem regionally. As opposed to just in our own silos. Right. And that, I think, has been magnificent. I was fortunate to be asked to chair this regional committee. The vice chair is Amy Akers, who's the VP and Chief Nursing Officer at Novant, who's an amazing leader in and of herself. She's a friend, but again, just an amazing leader. So, and there's others. Wilmington Health is at the table. There's other regional employers with vested interests in helping to solve the nursing talent pipeline. Yep. Long-term care facilities, another example, right, for certified medical assistants, CMAs, CNAs, and nurses. They were all kind of in this, we had a supply-demand disequilibrium. So anything can happen when you have more demand than supply. And what we realized, our hypothesis at least, was if we increase supply, right, would that allow everyone to keep arrows in their quivers? And so far, that's proving true. And so that collaboration has been, going on 3 years now. Yep. And so the early data has shown that it's been really helpful.
Absolutely.
And so we're expanding that now into other endeavors such as behavioral health, because that's another challenge in our region. So we've taken that chases and that blueprint, and we just want to build on it.
Absolutely. And to the point we talked about, where lowering costs within the healthcare system. Yeah. I mean, turnover and having a revolving door of people in and out costs organizations incredible amount of money.
That's right.
And ultimately, who's going to pay for those costs? Probably the taxpayers and the people that are paying their insurance premiums,
right? Right. It's shifted, that's right. And so that's a great point. What we realize is, besides the fact that it's frustrating,
highly frustrating, yeah.
You were in this world, like you would hire someone and you'd onboard them, and the next day they would be gone. And no one had ever seen that before. But again, the email inbox with an offer, right? $2 more, and then this is ghosting interviews, So it was something everyone was feeling. Yeah. And you're right, it was expensive and it was frustrating, and it was taxing the teams that were still there. Yep. And most importantly, it was leading to really just bad patient experiences.
Right, exactly.
And bad outcomes. And so from the acute care side, the outpatient side, operating room, ambulatory surgery centers, we were all feeling it. And so we just wanted to, how do we hold pressure right? And stop the hemorrhaging, and then how do we, what's the solution?
Absolutely.
And so we've had, Chancellor Valetti and Dean Mary Ellen Naylor from Cape Fear and other, really smart and really capable people helping us think through this. And if the answer is we need to admit more students into the nursing program, okay, do it, figure it out, right?
Yep.
And so other, things like that were previously unheard of, like we need to do something regionally in order to solve this problem. You've got the, decision makers at the table, and it's like, okay, cool, is that what we need? All right, well, you have my blessing, go make it happen.
Right.
And so those are the things that really were encouraging, and the endowment, of course, was playing a role in supporting some of this as well. Blue Cross has actually played a role in helping support this work. So again, statewide effort, the Chamber Foundation, Center for Workforce Health, AHEC. So this is not just regionally.
There's a lot of players involved in this.
Yeah, and we just happen to be perhaps at the forefront.
Right.
There's 9 or 10 different regions doing this. We just have leaned in really heavily, and so I'm a bit biased. But there's a lot of thought that Wilmington and the Cape Fear region and CHEC has gotten a little bit further ahead than some of the other groups.
I've seen Dr. Hill, from the chamber, provide some of the data and the results, and talking about, yes, we need to get students in the, we need to get these folks in the door. We have to get them educated, but then we have to keep them here.
That's right.
In our local economy.
Yeah.
So that they could serve our folks.
Yeah, that is the K-12 program. They've got the chamber and some others work with CLDA, Career Leadership Development Academy, which I'm not super involved in, but just like from afar, such a fan of.
Yep.
Engaging 7th graders.
Absolutely.
And just exposing them to all of the cool things that are in and around our region, and helping them to try to develop an affinity. Like, this is home, this is where you grew up. There's a lot of other cities that may call, but just keep us in mind. And trying to keep the talent here. So like getting upstream of what our previous thinking was, like not high school, but 7th graders. That's amazing.
Yeah.
So yeah, shout out to them.
Changing the subject just a little bit, and this is random. Since we were together last, I listened to a podcast about the story of how MyChart was started. What do you guys use for your internal
We
records?
use Athena.
Okay.
Yep, so our electronic health record system is Athena.
But so I was listening to this story, and on this podcast called Acquired, which is really, really, it's history. Like really, it's like the history of how businesses were started. But they were talking about the healthcare system and like why all these changes, but just the evolution of the healthcare system has changed so dramatically since, and I'm speaking a little out of turn because I'm not an expert in this, I'm regurgitating some information, but the evolution of the healthcare industry has changed so rapidly since basically like the 20s and 30s, and how insurance companies were created, and it was really companies that wanted to create these insurance companies so that they could provide health insurance as a benefit to get people in. And so go back to there to where the healthcare system is at now, and it has, just like any industry and any business, it has challenges.
Sure.
Right?
Yeah, you can say that. You can say that, yeah.
And
comma, keep going. Keep going, yeah.
But I guess, one of the things that I really wanted to talk to you about and get your feedback on is the idea of preventative care and addressing, the root cause of what creates sickness and illness and whatever, versus treating symptoms and just, hey, come in, come out. So I guess what's your stance on the idea of, being what can we do for, preventative care to keep people healthy on the forefront, which reduces costs in the long run, as opposed to just addressing the symptoms, let's say.
I will tackle that because I think there's a bunch of substrate for us. The health insurance, piece of that is there's often good intentions.
Of course.
But there are sometimes non-virtuous intentions as well.
Okay.
And that is just part of what happens when you're answering to stakeholders at the board and your shareholders.
Right.
Right. And so, there is this antagonistic relationship oftentimes between healthcare entities and organizations and insurance companies and vice versa. I wish it wasn't the case, but that's if you're a publicly traded corporation and you've got to show quarter after quarter growth, there are inherent challenges.
Of course.
What do we do about that? I have no idea. But I'm just calling out, right? You know how publicly traded companies, how that works.
Exactly.
You know that world better than I do. And so when those are the circumstances, you therefore should not be incredibly surprised when either cost-cutting measures or things that may seem like not good for physicians or sometimes not good for patients, like those things happen. And it's heartbreaking. How do we uncouple, right, our healthcare system from being, public? I have no idea.
Yeah.
People smarter than me need to figure that out. But it is sometimes frustrating. But when you are in the shoes that they're in, just understanding like this is quarter by quarter needing to show growth. And if you don't show the growth that was projected, even if you grew, like there's still a problem. Like what's going on?
Yeah, you didn't hit projections.
I wish that was not part of healthcare. I wish that it wasn't. But nevertheless. So, you and I really bonded over the book Outlive, right, by Peter Attia. And it's such a good book. And it gets into some uncomfortable spaces, not necessarily for those that are inclined to think about it, but for those that may have a little bit of a different approach to health and sickness and illnesses.
Right.
And so the truth is, I happen to believe like he does and agree with him that so many of the challenges that we have are as a result of daily decisions and lifestyle choices.
Absolutely.
And it can get controversial, but I do not care. I think the science backs that. That when we have the ability to work on and focus on sleep, exercise, and nutrition, and you can get fancy and sexy and talk about VO2 max and all those other things, right? But sleep, exercise, and nutrition and things that we do on a regular basis have such an impact. And I've heard about access to facilities, which is legitimate, but I also know you can exercise at home for free.
Yep.
I've heard about costs of eating healthy. The same $35 you can spend for a family of 4, right, at McDonald's, that $35 goes to Aldi, and it's a healthier meal, and it's just decisions. So I don't wish to be paternalistic, but I also have to be honest that there are some barriers that we have to break down and some misconceptions, all right, about metabolic health and the challenges of being dysregulated and insulin resistance and poor metabolic health and prediabetes, diabetes. BMI is not the end-all be-all. There's some challenges with how we assess, but generally speaking, obesity writ large and poor metabolic health does lead to problems right downstream in someone's life, and that's just the reality. A lot of folks may not want to accept that, but unfortunately that's just not the case. It is what it is.
Yeah, and that's the world we live in, and in such a fast-paced environment where we're always on the go and meeting deadlines and traveling, and I'm just gonna grab my Bojangles sandwich, or whatever it is, and by no means I personally have so much that I could do personally to support myself, but I think it also goes back to education, and also, I mean, how can, and that's what I love about entrepreneurship and small businesses is, how can, if a small business grows and can hire more people and give them a livable wage that gives them the opportunity to be able to be more healthy, that's how we can make an impact in our community.
Absolutely, and so that feeling of, that element of safety that you can provide your team. And that safety can mean a lot of things: financial security, job security, housing security, food security, right? Because all of those things, you're never going to be at your best version of yourself if you're insecure financially, if you're insecure from a housing stability standpoint, if you've got, job insecurity. So agreeing with you, the number of people that can gain that element of safety from their workplace. And then what happens after that is you can say, all right, cool. I don't have to worry about my paycheck because I feel safe here. Now I'm going to get this gym membership, or now I'm going to do the next thing, and these the virtuous cycle, that you start making good decisions. But I do believe that sometimes it starts with, do you feel welcomed? Do you have social connections? Do you feel like there are people that care about you within your home or outside your home? So we're really big on trying to build and that's been, honestly, we've had so many amazing patient experiences.
Yes.
I'm blessed. But the thing that has moved me the most was just seeing team members get to the next stage of life. Because when you start a business as a healthcare professional, that's not what you're thinking. Right. I'm going to take good care of patients and evidence-based medicine, and we're going to,
Yes.
try to be the Chick-fil-A of medicine. All right, cool. But when you start seeing your team winning,
Yes.
right? Some winning within your organization, some winning in going to med school, getting into PA school, getting to PT school, and then you're just like, man, this is awesome. And then you can see their upward trajectory of their life, and having played such a small role in that, but still being able to clap for them on their way up. And just knowing that outcomes that I may not ever see will perhaps be very different in their life because of that 2 or 3 years we spent together.
Absolutely.
And that's powerful. So.
And I think you've used this example when we spoke, and I've got some too. But when one of your team members is able to buy that home, or buy the bigger home because they need more space for their family, and their job is helping them support. I mean, it's just like such a good feeling.
We could argue like what's a better feeling, right? Having a team member get accepted to med school, or PT school or PA school, or having the bank call us for financial documents because someone's applying for a mortgage. Like either way, I'm like, this is awesome. You know what I mean? So it's a win either way, but like it's just good on good.
Absolutely.
Yeah, good on good.
How's it been with your team member, like recruitment, retention, and how's that been for you guys specifically?
Yeah, so I think we're in probably a better place now, right? In the beginning, not only were we new, right, but there were just circumstances, the COVID era.
Yeah, the stuff you couldn't control, completely outside.
There we go. We've got a really solid core. Our nucleus is solid, and so they kind of protect the culture, because when I'm not in the building, right, the core team is going to make sure, right, that the new team members understand, like, this is our way, this is how we do things, we look out for each other, et cetera, et cetera. And now with our most recent acquisition, merger, bringing the friends across the bridge at Bodish Family Medicine under the fold, we'll just have to do that same thing, and it's fun. And it's fun because they've got an amazing team there, right? They won't need much from us because Dr. Bodish has done an amazing job of cultivating that same thing we just discussed in his organization for the past 20 years. So we have the amazing opportunity just to kind of marry these two families and continue to try to do good.
Well, that culture and the fit is so critical to success in a merger or acquisition or a combination. And so this specifically sounds, it was an opportunity that kind of came up, and it sounds like there's as part of your due diligence, I guess, when you're looking at this opportunity. What are the things you're looking at? Is culture part of it? Is processes, systems, obviously some financial metrics, I'm sure?
No, that's a great point. All of the above. But fit is probably at the top. So Dr. Bodish, friend, again, a physician that I've known for a while. We worked together in a few other areas. And so when he decided to get ready to go do other things, again, I salute that and applaud that. I think there may have been another consideration or two, but I think he really wanted us to be able to partner with his team to take the baton and continue running the race. And so having had the chance to spend some time in his walls, his team has come and spent some time with us. I think there's just sometimes this organic, this just feels right. But then there's other times in which we've kind of explored, right, on the other side of the coin, a doc that maybe wants to shut it down or whatever the case may be. And you're like, ooh, this may not be a good fit. Right? This probably is not going to work because this either culture of this organization is more Viper than I'm used to, right? Or whatever the case may be. So we have to wish them well and go in a different direction. But due diligence is part of that.
What's it like sitting in the board? I say the boardroom, but like when you're having your leadership meetings or other. What's Dr. Bowers like, when he's in charge and running a meeting? How do you? What does that look like?
My team would tell you. It depends. So I always like to say there's a price of proximity.
Okay.
You know what I mean? Like if you're in the room, then it's likely you might get the smoke.
Right.
Because that thing needs to happen, or it didn't happen as we discussed or whatever the case may be. But the new people aren't in the room. Does that make sense?
Right.
So the price of proximity is like the leadership team is leaders that are proven and that have the ability to listen, learn, and execute. And so they are trusted. They're people I rely on a daily basis, and nights as well.
Yep.
And then so, there's the large team meetings is a very different, as you know, in organizations. The large team meetings are more about learning, developing, right, teaching, celebrating, encouraging. And then sometimes the more senior members of the leadership team have to come together and have to have uncomfortable conversations about where we are, where we need to be. Still celebrating and building, but it's a different conversation.
Share some examples where you've learned through doing on how you've become a better leader, let's say.
Oh man, okay. Well, I'll tell you what. I'll tell you what. So this happened yesterday. Today's Tuesday, right? This happened yesterday. There's a team member that something happened with another team member, and the practice manager dealt with it, right? And then another team member on that side of the building, it was like, hey, let's chat, let's catch up. But life got in the way, or patient care got in the way, and we never chatted. And then I heard from this team member that she was scared because she thought she was going to get fired. And I felt terrible. And so as soon as I heard that, I guess this was maybe over the weekend, and then yesterday we called her into the office with the practice manager, and I said, I'm so sorry, right? You're absolutely right. We said we wanted to chat with you. It was somewhat related to, the situation that the practice manager had just dealt with, but she had a little bit of uncertainty for a couple of days, not knowing, oh man, and that element of safety had been removed from her. And so I apologized, and I said, I'm so sorry. Yes, we did need to chat with you. And it didn't happen because it was a small thing, not a big thing, but something that still, in her mind, there was uncertainty. And so I apologized, and I said, I'm so very sorry. Here's the thing we wanted to chat with you about. It took 2 minutes, right? Whatever the case may be. But by putting that out there, maybe the practice manager said, hey, Dr. Bowers and I want to chat with you at some point today or in the morning, and then whatever happened, and the conversation did not happen as or when we said. So she was wondering about her job status for no reason, right? I mean, clearly that was not it. It was just we wanted to have a conversation about a following up, if you will, and so that ambiguity, I felt terrible. And so I apologized, and she fortunately understood.
Well, it goes to something that I personally deal with as well is, our clients, our customers, our patients are extremely important. Our team members are also very important, and sometimes throughout the week or throughout the day, it's like, all right, there's only so much time in the day, and you've got to prioritize stuff.
True.
And, having the intuition to say, hey, you know what, this employee is more important right now, or you know what, this client and this patient's actually more important right now.
It's a tug of war. And all day long, I'm thinking, how many people are thinking I'm failing them? All day long. Right?
Being a leader is hard.
You know what I'm saying? Like my mom, it's like, all right, 15 minutes and I gotta go, Mom. Am I a bad son? It's like all across the day. Like, who am I not spending enough time with? Does my 6-year-old son think Daddy's not spending enough time with him? Does my practice manager get enough time? My lovely wife, who manages the household, manages the office. And all day long I'm thinking, who am I failing? How many people am I failing? How many people think I'm inconsiderate? Because sometimes you're just spread so dang thin, you're trying your best.
I mean, how messed up is that? That is such a true and valid point of being, having responsibility. Truly, it's like, who am I letting down right now?
Who thinks I'm an inconsiderate jerk? Because I said I have 30 minutes for this meeting. I don't have 60.
Right.
What I mean?
Exactly.
It's like, well, excuse me. I'm like, well, there's 3 other things I need to do in that 30 minutes.
Yeah.
It may include eating lunch.
Right.
You know what I'm saying?
Or
So,
some care, some personal care, so that I
breathing.
could be a better person.
Totally, breathing. So yeah,
You know?
that's that balance that we talked about.
Yeah.
So yeah, you know, and so those things are very different at year 4.5 or 5 than they were at year 1 or 2.
Yep.
And so there is a transition that you go through when your access to you is different, right? And this, I say this with humility, but you know, when you're involved in more things, then that means access isn't the same, with the utmost humility. And I had a conversation with, actually, believe it or not, it was Chancellor Valetti, I think over the holidays, and he talked to me about, you know, just thinking about even applying for the chancellorship role, the chancellor role, and just the conversation around growing out of certain spaces and the people that either helped you get to those spaces, right? How it can be really uncomfortable, but if you've grown out of that space, you have to acknowledge it and you've got to move on. And sometimes it's really tricky and you have to navigate feelings, you have to be very respectful. But that's just kind of part of leadership and part of growth. You grow out of certain spaces.
Absolutely.
Yeah.
What in your career, take the personal side out of this, focusing on your career, what are you most proud of?
To be honest with you, I would say most proud, there's a ton of like anecdotal experiences with patients that have just, you know, caught the thing, right? Caught the cancer, caught the whatever. There's a ton of anecdotes over the 13 years that I've been practicing.
Yeah.
But I'll be honest with you, my wife was born here, and to have a medical facility 2 miles from where she was born and have her be such a large, right, player in that equation, I'm very proud of that. And I don't think she ever thought she would come home, right? She went from Rocky Point to Raleigh, went to NC State, and then we met in Winston-Salem. We're at Wake Forest, and then from Winston-Salem to Charlotte, and that could have been the end of that Charlotte region could have been the end of that story. But for us to really have the crazy notion to come hang a shingle in Wilmington, and you know, a place that means a lot to her. Her parents are still here, her sisters are here. She's got, you know, a ton of family here. For her to be, you know, in her hometown, caring for people and leading a team, I love that.
That's
I love
awesome.
that. So it's I'm kind of not directly involved, but I'm a cheerleader, if you will, for that success story.
That's amazing.
Yeah.
And you guys are just so involved in the community. I mean, like you talked about, all the different groups, associations, boards that you serve on, and you know, to be able to do that in, you know, your hometown, so to speak.
Yeah.
I get it.
It means a lot for me to see her, you know, add value.
Yeah.
To a place we both care about.
So, what does the future look like for Dr. Bowers and Dawson Med 5, 10, 15 years down the road?
We're just going to continue to focus on delivering care in her hometown, and now our hometown, in a very deliberate manner. Right? We don't have grandiose ideas and goals and aspirations. We feel like what we're doing is meaningful, and there's a number of patients that greatly appreciate it. We, as you know, are going to be, you know, providing care in Leland as of April, right, which we're excited about. But, you know, our current goal is just to continue to recruit amazing team members, deliver an above average amazing experience to our patients, and just be thoughtful and listen. And we'll see. Wilmington is growing. We're excited to be in Wilmington at this exciting time.
Absolutely.
That was, frankly, our prediction when we were in Charlotte, thinking about, you know, what it would look like moving to Wilmington, and we saw Wilmington would likely be on the rise. And so as we do all those things, also spending as much time at the beach as possible.
Yeah, gotta enjoy life, man.
That's right. Put your feet in the sand. I like to say, remember, people drive hours to come to where we live.
Yeah.
So let's not deprive ourselves of whatever it is, fishing, whatever it is. Maybe it's not your thing. I love it, and my son loves to fish. We love to get on the water. So trying to do as much of that as we possibly can.
Very good.
Yeah.
Well, thank you for everything that you do in our community.
Likewise.
For your leadership. And we were talking about, you know, how valuable our time is, and thank you for making time to come and spend it here with me.
I appreciate it. And these nice new chairs as well.
And these nice new chairs.
Thanks for having me.
I
Thanks
think
for all
they
you
did
guys
pretty
are doing.
good.
Yeah, this is a win. This is the win.
Awesome. Well,
Yeah.
thank you, Dr. Bowers.
Thank you, my friend.